Palliative care is a medical specialty that focuses on relief of symptoms for patients who have been diagnosed with a life-limiting illness. We focus on symptom management, we focus on education, support, and helping to make medical decisions.
Listen to one patient's daughter describe her family's journey through their father's terminal diagnosis and the impact palliative care made in helping him live the end of his life the way he wished.
My father became ill and had to be hospitalized at the beginning of October, and so things went south, if you will, very quickly. So we came in not really knowing what was wrong, and then very quickly he was sent to ICU. He was put on a ventilator for a few days, so there was no communication with him, and through a series of tests we found out that he had cancer in his stomach in a very sensitive area, and we're told that he wasn't a candidate for surgery because of, he probably would never make it through what they called a Whipple procedure, and would also mean he wasn't a candidate for chemotherapy. And so we're forced to make a lot of very quick decisions about his care, and consulting with each and him a lot on what that's going to look like and whatever time we had left with him.
Most of us hope that when our loved ones get sick, doctors will be able to revive and restore them. Often this is true, but sometimes it isn't.
You also begin to see as much as we know that we can do with acute care medicine, and as much technology, as much knowledge, as much as we have, that sometimes that's really not going to help people at some point in their life. And we begin to realize that there are other things that I can do for you, that we can do these things to you, but what are we really doing for you?
When cure isn't possible, or when a medical situation warrants more than medical care, palliative care may be appropriate.
Palliative care is for anyone who has a chronic illness that we can't cure that needs that sort of interdisciplinary assistance for their suffering. So it could be someone that we think may live for years and years. Often, and most of the time in the hospital, it's still brought out mainly in the last year of a person's life.
Palliative care is life-affirming, but it also acknowledges that death is a natural process that comes to us all. Palliative care aims to compassionately treat the whole person, not just the body.
Since suffering is a whole person problem involving not just their physical, but their mental, emotional, and spiritual life, we have to attack suffering with an interdisciplinary team that covers all those things and take all that into account. But there are illnesses that we can't cure, illnesses that keep on coming that cause hospitalization after hospitalization, or illnesses that continue to cause pain and discomfort even when they're being optimally treated. And those things are those kind of illnesses are the type of things that palliative care can be very valuable to help. So in terms of hope, curative care is a hope for cure. Palliative care is a hope for comfort and dignity. In terms of the approach, curative care looks to really get rid of the disease or the problem if at all possible, whereas comfort care or palliative care looks to decrease the suffering and make life as good as it can be.
In order to meet patients' varied needs, palliative care seeks to first clarify and respect the patient's own goals regarding his or her health and quality of life.
What are their goals? What are they looking forward to? What do they think is the best life that they can have at this point? And usually once I learn that from folks, it becomes pretty obvious whether it's time to go more from the curative care model to the comfort care model or not. If you're been admitted to the hospital 3 times in the first half of the year, that's a clue that there may be something there we haven't been able to fix, and we ought to talk to you about, okay, how can we make your life the best it can be by shifting our focus.
Determining a patient's own wishes can be challenging.
Well, the patient may be at one level trying to tell you something about what's happening and what their desires are, and the family, as you said earlier, you want to hold on to Dad and keep him as long as we want to. And so there's this tension even between loved ones, you say, well, you just hold on, and maybe you can, we can do this, and we can do that. Tell us a bit more about it.
Yeah, that was tough because there are mostly the 6 children to my mother and father trying to make most of these decisions, and there's 6 of us. So there was a lot of back and forth and lots of conversations, some not so easy, with Dr. YD. We had a family meeting at home about it, and had a tough conversation in terms of what Dad would have wanted, and made a decision that we weren't going to pursue, I guess, what would be called the aggressive treatment with the Whipple procedure and the chemotherapy, but concentrating on loving and caring for him and providing him with as much comfort as we possibly could.
Once the patient and family come to an agreement regarding the patient's wishes, the interdisciplinary team can help the family determine a palliative care action plan. Patients and their families don't need to wait until the end of life to ask medical staff to integrate palliative care.
If a family member is wondering if palliative care might be right for their loved one, or if a patient is wondering if palliative care might be right for them, if they've been diagnosed with life-limiting illness such as cancer, pulmonary disease such as congestive heart failure, COPD, any disease that has damaged their liver or kidneys, palliative care might certainly be appropriate for them. Also, anyone who's experiencing uncontrolled pain or other symptoms such as nausea, palliative care might certainly be appropriate for them as well.
Early in the disease process, palliative care may be combined with medical therapies intended to extend or prolong a person's life. The closer the individual moves toward death, the more intensive palliative care becomes, and the less intensive life-extending therapy becomes.
When you have someone that has a chronic illness, whether heart or lungs, they're receiving acute medicine, they're receiving what we call curative medicine, but as they begin to progress in their disease, that's when you want to progress with palliative care. So, we often think of palliative care as end of life, and that's part of what we would call end of life care, but also you want to start palliative care earlier, where there's patient and family education, where you look at comfort measures, physical and spiritual, psychological. There are all types of comfort measures you want to progress in the patient's continuum of their life.
Some patients and their families worry that by requesting palliative care, they are giving up.
When a patient tells me that they don't want palliative care because they feel like they're giving up, I respond with trying to help them refocus their goals on their symptom control and relief. Palliative care is not giving up. It's simply a different way of treating a disease process.
Ultimately, palliative care is not a decision to forsake hope, but to understand that hope primarily in light of the patient's quality of life.
Once we came to the decision to bring my dad home and talk through what that was going to look like, and made sure that everybody was on the same page, that hospice is going to help us, but that means it's not going to be aggressive treatment. It's going to be, let's make him as comfortable and provide him with as much love and care as we can in the time that he has left. So I think once everybody understood that that's where we were going with it, and if we were going to bring him home, that's what we were looking at, then they came to terms with it.
Coming to terms with a loved one's terminal illness takes time and often includes many difficult conversations. AnMed Health's interdisciplinary palliative care team is prepared to help you and your family navigate this transition.